How important is your eyesight? Many people say it is by far the most important of all the senses. Our sight is our window to the world where we can see color, action, emotion, words, faces, and events in a way no other sense allows us to. Good vision comes with a serious price. The annual financial burden of major adult vision disorders exceeds $50 billion annually. Most of us think that if we have healthy eyes, we have good vision, but this is not true. We actually see with our brain. In fact, sight is so critical for humans that about 45% of the brain is dedicated to the sense of vision. Neurological problems affecting vision include disorders you may have heard of, such as multiple sclerosis, myasthenia gravis, and stroke. Preserving and restoring vision is an important medical challenge, but first, an accurate diagnosis is required. Helping people accomplish this task while containing costs and avoiding unnecessary testing is the mission of the North American Neuro-Ophthalmology Society, or NANOS. This society consists of the only physicians capable of evaluating the complete visual system. NANOS educational programs ensure that its members are at the cutting edge of knowledge in their field. It allows them to provide the best clinical care of the visual system, to teach other healthcare providers, to support research in neuro-ophthalmology, and to train the next generation of neuro-ophthalmologists. The neuro-ophthalmologist specialists at NANOS stand at the forefront of innovative developments in the restoration and preservation of vision. Neuro-ophthalmologists are unique physicians who combine the disciplines of neurology and ophthalmology in order to diagnose and treat complicated vision disorders. They understand the complexity of problems affecting the entire visual system. They are best positioned to identify cases of visual loss related to systemic illness or unexplained problems, and they are developing new and innovative treatments.
We gather records from the patient's medical doctor and from other physicians that they've already seen. We review the records. We review the images and other lab tests if they've already been performed. We take a very detailed history and do a very thorough examination, and then put all of these things together to try to formulate our decision.
When you consider that approximately 45% of the brain is dedicated to our sense of sight, it is easy to understand that the eyes, brain, and other body systems must work in concert to give us clear vision. Major vision disorders are not always the result of a malfunction of the eyes. Often, a problem within the neurological system is the root cause of a severe vision disorder.
The ability to diagnose the root cause of a visual problem, which is not apparent immediately to an ophthalmologist or neurologist, comes from having a detailed knowledge of the underlying causes which might lead to that situation.
During what is often a lengthy and detailed visit, the neuro-ophthalmologist applies high-level cognitive skills to the interview and physical exam of patients and, by applying their experience and knowledge, can often quickly diagnose a condition that may baffle another physician. This not only provides better patient outcomes, but also saves the medical system and the individual many unnecessary healthcare costs associated with radiologic procedures and other diagnostic evaluations. To arrive at a proper and efficient diagnosis, the neuro-ophthalmologist must perform a time-consuming consultation with each new patient. The specialist must take an extensive patient history, perform a physical exam, and sometimes perform diagnostic tests in order to pinpoint the true cause of a vision disorder. This often results in a correct diagnosis in only one consultation and the elimination of unnecessary procedures such as expensive MRI scans. After arriving at the diagnosis, the neuro-ophthalmologist may initiate treatment or make treatment recommendations to the referring doctor.
I'd like to refer you to somebody that is a specialist in this area.
There are cases where a primary care physician refers a patient to an ophthalmologist who orders an MRI of the brain in order to diagnose a disorder. When that does not identify the issue, another diagnostic procedure or treatment may be prescribed, and those may not work either. Some physicians often try to treat the disorder only through the ocular system when, in fact, the cause of the problem is due to a neurological issue. the patient is forced to endure a long, frustrating, and expensive battery of testing and procedures that do not identify the disorder. This time lost could result in permanent vision damage, not to mention the enormous amount of money it can cost the individual and our healthcare system. Neuro-ophthalmologists often help preserve and restore a patient's vision through their unique perspective, experience, and expertise. Their intricate knowledge of the ocular and neurological system and how the two interact gives them a specialized perspective and insight that a neurologist or ophthalmologist alone simply does not have. The North American Neuro-Ophthalmology Society, or NANOS, remains at the forefront of innovative developments in diagnosis, preservation, and restoration of vision, but they are facing a very serious challenge in today's cost-conscious healthcare industry. There is increased pressure on the primary care physician to be cost-efficient. This includes selecting the right referral, and for complex or unusual visual disorders, their best choice is often the neuro-ophthalmologist because this dual specialist can consider all the possible causes of the vision disorder. However, recent federal policies and restrictions on the reimbursements for diagnostic consultations are making it more difficult than ever for a neuro-ophthalmologist to be able to practice and get paid for the longer time it takes to perform a complete diagnosis. Since most neuro-ophthalmologists' goal is to eliminate unnecessary testing and procedures by getting the diagnosis right the first time, this reimbursement strategy penalizes the neuro-ophthalmologist for efficiency and makes it difficult for a neuro-ophthalmology specialist to survive. NANOS is very concerned that this restriction and limitation will force many current neuro-ophthalmologists out of the specialty and discourage new medical students from entering it. The sad result would be fewer and fewer neuro-ophthalmologists to care for your children's complex visual problems in the future.
It is important that we be able to attract young people going into medicine to neuro-ophthalmology as a subspecialty to permit access by patients to detailed evaluations and highly knowledgeable physicians in this area. If we do not have the ability to attract people based on the ability to earn a reasonable income, it will be very hard to provide that kind of access for patients in the future.
The Society is dedicated to reinstating the proper reimbursements for the extended time required to do the complete patient consultation and cites the enormous cost savings and the infinitely better patient outcomes that result from getting it right the first time.
There are not many physicians these days that take the time that we take and spend it talking to the patient, reviewing their lab work, performing a very detailed physical examination, and trying to put everything together, sometimes even consulting with other colleagues to try to get the right answer.
Few things in life are more precious and priceless than our vision. When it begins to fail, the world can become a very frightening place. It is crucial that everyone see the benefits of these specialists today so that we can continue to support the vision of tomorrow. For more information, you can visit their website at www.nanosweb.org.